Long COVID-19 or post-COVID-19 syndrome has been dubbed as another health crisis in several countries, including the United States. It is estimated to affect 10 to 30% of persons who were infected with COVID-19 and involves experiencing serious symptoms months after being medically cleared of the disease. While it is unclear how many of the more than 19,000 persons who were confirmed COVID-19 positive locally fall into this category of long haulers, Minister of Health Dr. Frank Anthony has confirmed that medical practitioners have witnessed a few cases. During his daily COVID-19 update on Monday, he pointed out a number of long COVID-19 related symptoms that healthcare workers across the country are on the alert for.
You also have patients presenting with changes in their renal system, their kidneys, and that's another area that we have to do tests and to check and to manage. With the endocrine system, we have seen some people who had diabetes, and if they get COVID, it is more difficult to manage the diabetes.
While there is no clear diagnosis for long COVID or guidelines as to how such cases should be treated, Dr. Anthony informed that healthcare providers will conduct the necessary evaluation of the patients and treat with the symptoms. He is urging persons who suspect they might be a COVID-19 long hauler to visit the nearest hospital.
Patients who know that they have been infected with the SARS-CoV-2 virus can come to any one of the regional hospitals, and I'm sure the clinicians there would be able to do the relevant tests to see whether or not they're experiencing any of these problems that I mentioned.
Cognizant of the serious debilitating effects of long COVID and the great attention being paid by other countries to help long haulers, this newscast has been incessantly highlighting the issue and has been trying to find out from local health officials their response to this new and disturbing health phenomenon. Head of Medical Services and Cardiology at the Georgetown Public Hospital, Dr. Mahindra Karpan, during a recent interview with this reporter, highlighted that indeed a number of long haulers have been accessing treatment for their symptoms, which is all that is being offered at this time. Last week, Nikola News also interviewed Nia Suban, who chronicled the daily debilitating array of symptoms that he continues to experience more than a year after recovering from the disease. These include shortness of breath, difficulty sleeping at night, and inability to fully utilize one of his arms. Suban currently attends physiotherapy sessions, which has been assisting. Meanwhile, moderate responses were recorded to the vaccination drive-through events held at the weekend. As of Sunday, 231,766 persons had been administered first doses of the COVID-19 vaccines, while 106,344 are fully vaccinated. Temika Rodney reporting for the HGP Nightly News.